Hey guys, I am 5 days post-op from my mommy makeover surgery, and in this segment I thought I would cover the top things that I wish I had known before surgery. And some of these things truthfully I did know, but not a lot of people know, so I'm going to cover them anyhow. So the first thing I want to talk about is the Lynn Service. So if you are having surgery in Canada, and specifically Ontario, Canada, you actually have access to free home health care. Now, your plastic surgeon probably, well, some do talk about it and some don't. My surgeon, for one, did not tell me anything about this. And I know other surgeons that I consulted with, they sort of marketed that they provided home care after the surgery. But they market it in a way like as if it's something that they're providing and that you're paying for. But really, it's a free service that's provided by OHIP in Ontario. So I'm not sure exactly why some surgeons are sticky about ordering this for their clients, because I would imagine that having really good aftercare is really key to your long-term outcome with your surgery. So you would think that most surgeons would want to order home care for their patients just to keep an eye on things, to do regular dressing changes, and to also just sort of monitor, because a nurse coming to your house will be able to see the early signs of infection or something that could be going wrong. But for whatever reason, they don't always offer that as a service. I know I had learned about it through some local groups that I'm part of, and I had people tell me no, like I was looking at one point to hire like a private PSW or nurse to help me post-operatively, and I actually had people tell me, hey, no, like you don't have to pay for that, your surgeon should be providing it. So in case you weren't aware, you can absolutely advocate with your surgeon to get some post-op care in home. All they need to do is place a request through the Lynn, the health network in your area. Depending on where you live, there'll be a Lynn in your area, and the doctor will have to fill out forms in order for you to get that service. Now, you can request for services, but they will only do that for PSW care. They will not do that for nursing care. And for nursing care, you have to have a nurse to deal with dressings and drains. A PSW is not allowed to deal with those items. But if you wanted to get a little extra help with a PSW, maybe for showering or things like that, that is something you can personally call for. So I want to tell you to please speak to your surgeon, especially if you're having extensive surgery like I did. I had a full mommy makeover, tummy tuck, lots of liposuction, breast lift, augmentation. And having the nurse come every day, once a day, has been really, really helpful in terms of managing my dressing changes, and even just learning from the nurse how to do it properly, and just knowing that I have someone overseeing my aftercare, and that they know better than I do sort of what the signs and symptoms are to look for. So that would be my first thing that I wish I had known, and that I did know, but not really very much about. Along that same token, number two, what I want to tell you is that your post-op care is mostly on you. So it's really important that you understand your surgery, and that you understand sort of what your post-op recovery should look like and what to do for yourself, and that you make sure that you have the right care aside to help you during that. One thing I would say that I'm a little bit surprised by is that my surgeon's office hasn't really been calling to check in on me every day. And I would have thought that after spending $30,000 on surgery, that someone would be calling me maybe even just once a day to check in on me, but they don't. I think they take the school of thought that no news is good news. So if I'm not calling them on the emergency line, then they assume that everything's going well, which is technically true. I've been great, and the emergency line that I have available to me, someone answered right away when I did have a question. But I don't know, maybe for me, I would have liked it a bit better if at least they called my husband just to check in on me every day. So just know that, maybe every surgeon's different, but my experience with Dr. Kara, his team is absolutely amazing. They are not on top of me with the post-op though. It's really on you. And funny enough, they send you home with a stack of paperwork of post-operative care instructions that you sign off on right before you go into surgery, that basically says that you're responsible for your post-op care, and that if you don't take care of yourself as per the instructions, you may not get the desired results. So make sure that you know what to look out for in terms of infection, in terms of pain, and what's a normal amount of pain and what's an unreasonable amount of pain, and make sure you have lots and lots of help. There's no way that I could have gotten through this first 5 days so far without my husband and my mom, and without all the extra help I've had available to me. So thank goodness for that. The other thing I wanted to talk to you about was the difference between like pain, but also like pressure and tightness, and then also like anxiety and panic. So I made a bit of a mistake the first few days out of operation, that I was expecting like throbbing, excruciating pain. And if I was feeling that pain, then I should take my pain meds. But I didn't realize that it wasn't so much pain, but there was a lot of pressure, especially in my chest area, and tightness. And I wasn't taking my pain meds, the Oxy namely, because I didn't think it was pain. I just thought it was tight because of the implants. But then I started, because I was so tight, I started getting like panic attacks and anxiety. Because I couldn't breathe very good. So looking back, like I wish I had realized that pain is pain, but it's also pressure when it comes to breast augmentation. And if you're not managing it, it is normal to experience like shortness of breath and to almost have like little panic attacks. And if you are going through that, then you do need to keep up on your pain medication. So I wish I had realized the importance of keeping up on that pain medication, and not cheaping out on it, and to look out for more than just throbbing pain, to also keep a lookout for that tightness and pressure, because that's also relieved through your pain medication. On the topic of pain, the other thing I wish I had known, and I mean, it's fine, but like I totally thought that the tummy tuck was going to be the worst part of the mommy makeover, but it actually isn't. The breasts are so much worse, in my opinion, than the tummy tuck. The tummy tuck incision in that area has been totally manageable by just kind of keeping hunched over and keeping my legs propped with a pillow. But the chest and the tightness in the chest and the stiffness and the soreness and the armpit pain and all that pressure has, in my opinion, been way worse than the tummy tuck. And going into surgery, I thought the opposite. I thought the tummy tuck would be worse. So I wish I had sort of known that and prepared for that a bit better, if there is a way to prepare for that, or at least know that the chest was going to be way worse than the tummy. So it may not be the same for you, but for me, and now I'm finding that for a lot of women, the boobs are way worse. Next, I wanted to talk to you about the importance of rentals, or like acquiring assistive devices at home. So I have a feeling a lot of people really downplay this, including my surgeon's office. When I ask them about things like renting a hospital bed or a lift and recline chair or my walker and lifted toilet seat or a stool for in my shower, they sort of looked at me weird, like, nah, you don't need those things. Like no one really ever uses those things. But I remember watching a lot of other vlogs and women using those items. And I just remember thinking myself that I think life would be so much easier if I had those items. And so I'm really glad I trusted my gut. And I want to tell you that I was 100% right. Like the hospital bed was a game changer for me. And same with having the recline chair. Now I didn't have a lift and recline electronic chair. That would have been amazing. And I do recommend that if you can get it. I just bought a used $20 normal recliner chair, and I got some extra help with physically reclining it when I needed to. Luckily I had help for that. But like the stool in the shower has been so helpful. I don't think I could have managed showering without that. The walker, oh my gosh, like so helpful for my little walking breaks and for taking some pressure off my back. The lifted toilet seat, also very, very helpful. I do have elevated toilet seats and elongated toilet seats naturally in my house. But on top of that, I got the handicap accessible with handlebar toilet seat, and that has been super helpful. So don't let people sort of talk you out of those items if you have access to them, or if you can even buy them used online or borrow them from someone, or check your healthcare coverage, because I checked my husband's healthcare coverage. I called Green Shield and they said as long as I had a doctor's note, all those items were covered. The doctor, with a bit of hesitance, wrote me a doctor's note for all of them, and I got them 100% covered, and they've been a life changer. Sorry for the outfit change. I'm recording this series in a couple of different segments, just because I want to give you guys as much information as possible. Go Leafs, go. Okay, so the next thing I want to talk to you about is nausea. Make sure you've got a lot of gravel. I've used 2 full packs of gravel in a week. I didn't realize how much nausea I would have post-op. Pretty well every day I'm taking gravel. Even now at 1 week post-op, I wake up quite nauseous in the morning. I'm not sure exactly what it's from. I have a feeling, and the doctor says it's usually from the pain medication, sometimes even the antibiotics. So make sure you have the gravel, because you should really take it, I would say, with your pain medication, with your antibiotics, because one of those is making me nauseous every day, especially in the morning. As a result of that, it's been a really big challenge for me to eat certain things every day. Like, for example, one morning my husband was cooking bacon and I literally was sick to my stomach. So meat has been difficult for me. I find my cravings to be very similar to when I was pregnant and I was very nauseous. So for me, I like cold, crunchy, refreshing, healthy foods when I'm nauseous. Not meat, not usually dairy, not usually anything fattening actually, which is a good thing. But on the same token, protein is really important post-op, to be eating protein. And I know for me, meat has been an issue just because of that damn nausea. So stock up on the gravel, girls, and make sure that you're ready to get that nausea under control. I especially take 2 gravel whenever I got to go into the car. So for my 24-hour post-op appointment, that 24-hour, 1-hour car ride for me going from York Region to Scarborough to go visit Dr. Kara was horrible in terms of nausea in the car. Pack a barf bag for the ride home the day of surgery and for like the first week while you're in the car post-op, because you are very likely to vomit. So if you guys were following my vlogs in this journey, you know that I practice keto diet and that my goal was to maintain my keto diet through my recovery, to help minimize my swelling and just help me feel better. I really wished that I could have done that, but on the same token, when I checked into my pre-op, when I checked in the day of surgery with my sugar-free electrolytes, and I told the pre-op nurse that I didn't want to be offered juice or pop after my surgery, she basically got mad at me and told me absolutely not, no restrictive diets during your post-op, and that you should eat whatever your body is craving, and that a certain amount of sugar and carbs is important for recovery. So with keto diet, obviously that's an issue, because with keto diet, I don't usually have sugary drinks or sugar in general, and I don't usually eat carbs. So I kind of took what she said and I said, I'm gonna see how I feel after surgery and go with it. So with the nausea that I was having after surgery and with the strength of especially the oxy pain killing medication, my stomach legit needed bread. I needed carbs. And honestly, some fruit like pineapple is really, really good for recovering. The bromelain naturally in pineapple helps with swelling and bruising. So I will say that I have been off track on my keto diet for the last week post-op. I am, as of today, day 7, going to get back on track with my keto diet, provided that I'm feeling well. Up and until now, day 7, I definitely needed some extra carbs and I definitely craved some fresh fruit. So things like grapes were refreshing to me. Green apple helped me with nausea. I didn't end up drinking any juice or pop. There was some times where I had a diet ginger ale only because I was craving ginger ale and so nauseous. So the keto diet post-op was a bit of a flop for me for the first week, but I'm happy to be back on track. And I'm actually now going to encourage you that if you are on any type of restrictive diet, you should probably throw it out the window for the first week post-op and just trust whatever your body tells you you need and want. Within reason, obviously. You want to be eating healthy foods. You definitely want to be having protein. But if you're not a carb girl or a sugar girl like me, don't kill yourself over a slice of bread if you need it to get that oxy down safely, because it's going to be way better than dealing with the side effects of the heartburn that you also will experience with that nausea. And just be kind to yourself. I have to say, even though I've been off track this week with my carbs a little bit in the fruit, I'm not really noticing a huge difference. So I bet you my body's using it, and that's okay. Girl, your first poop after your tummy tuck or mommy makeover is no joke. It's no joke. And I don't want to scare you, but you need to prepare for it. And I want to tell you that the stool softeners that they give you, they're probably not going to be enough. So I took stool softeners 2 a day, every day, for a good week and a half prior to surgery. And then after my surgery, I started taking 2 twice a day. And I still did not have a bowel movement for 5 days post-op. So at my 5-day post-op visit, and I've covered this topic in my 5-day post-op video if you'd like to go take a look at it, my Lynn nurse told me I had to poo. It wasn't healthy for me not to poo that long. And I have regular bowel movements, so it's not really like me. So my mom and I got real personal. And I'm gonna post some pictures after this to show you. But essentially, I had to go get a glycerin adult suppository. And my mama had to help me out. And that mixed with also taking a stronger laxative, Ducalox, that did the trick. The first few poops, blockages we'll call them, are the hardest. Once you get those out and you maintain regularity, it gets much, much better. But that first poop, just be prepared for it. I think the problem is that you just don't have the ab muscles post-surgery, and those damn pain meds, like they're just so strong on your stomach. So I don't personally think the softeners are enough. Like I think you should just prepare for the suppository and take a stronger laxative post-op. Try to prevent that really bad initial blockage. It's not your fault, it's the meds, and it's the changes, I guess, in your body. And without getting like super graphic, like if someone needs to go fishing in there, or if you need to, maybe have a glove ready. That might need to happen as well, because, and I'm saying this because I've talked to several girls about it and no one really likes to talk about it because it's super, super private and gross, but like we physically don't have the muscle after surgery to push out some of those. So don't be shy if that happens to you. And I'm sorry, this is way too TMI, but I'm telling you this one woman to the next, just be prepared for that. Have a glove ready, have a suppository ready, have stronger laxatives ready, and just give it some time. And I promise you, after that first poop, it'll get much better. Okay guys, we're gonna get a little personal here. And I'm gonna show a picture after this little segment to describe what I'm talking about. But I don't know about y'all ladies, but before I had like my upper torso, which was okay, just a lot of ab separation. And then I had my belly button. And then after my belly button, I had like space between my belly button and like my vulva, like the crack of my vagina. And that was like flub, basically. And that's what I got cut off during my tummy tuck. What I didn't really think about, and it makes sense now, is that when you get a tummy tuck, they cut that all off. So you essentially then go from your belly button to like a little bit of skin now, and then your start of your mons area and your vulva, vagina area, which means your hairline moves up. So my incision right now is separating my clean, dry, hair-free skin. And then below that and at the incision line is where my pubic area begins and hair. So I didn't really realize with the tummy tuck how flat you end up becoming, and how previously that flub sort of separated my torso from my vaginal area. But it's the real deal, and it looks a little different. It's more raised, and the only thing I can describe to you pre-surgery is to go in the mirror and like take your hand and like put it on that pubic area and sort of lift up a little bit. And when you do that, that's going to give you an idea of what your post tummy tuck vulva will look like, if I'm getting correct with my terminology. I believe they refer to that area, like that sort of camel toe puffy pubic area, as the mons area, and some women actually go for what's called mons surgery to reduce the puffiness in that area, because some girls really suffer with it really sticking out and then it shows in clothing and stuff. I didn't personally have that or need that, but I was very shocked and sort of not prepared for the difference in how my body would look going from belly button to like so much less skin there now, and then my hairline area. So I'm really thinking post-surgery, I'm gonna have to go look at some type of long-term laser hair removal situation, because it's gonna be a lot more difficult to maintain now that there's, I guess, the scar line there. And it's just higher than what I'm used to. So even like with bathing suits and underwear and stuff, yeah. So that's not necessarily a positive outcome from the tummy tuck, but it's definitely manageable. It's just different. So I wanted to point it out to you, and I'll follow this up with a little bit of a picture so that you know what I'm talking about. So excuse the sensitivity of that content. One of the things that I was hearing a lot about going into my surgery was how awful the drains are. And I want to just come here and say that they weren't that bad. I've actually had my drains for 7 days now. I actually still have my left drain. And I have to say that they served an amazing purpose, and they weren't that bad to deal with at all. I'm going to give you a tip. Actually, I bought these Jordache comfy track pants from Walmart for like 25 bucks, but any kind of loose pants with deep, low, big pockets, perfect hiding spot for your drain. Crap, that's already 25 cc's. That means I'm not going to be able to get this out tomorrow, which I was hoping for. Man, this left side. Anyhow, so the drains are not as bad. I mean, yes, do I want them out? Yes, but have they been so difficult to deal with? No, not at all. So the drains, you know, you got to live with them. They serve a purpose. They stay in my pocket. No one really sees them. You can hide them very easily, tuck them in. I want to say that I feel like the drains really do serve a purpose in the tummy tuck procedure. I know there's a lot of new age doctors who are promoting drainless tummy tucks. I've never had a drainless tummy tuck, but I want to come right out here and say that I don't think it's something I would want now, knowing the amount of liquid that's come out of me with a drained tummy tuck. I can't imagine not having a drain. Like, all that liquid would have stayed in my body, and I would definitely have needed to go and get that taken out somehow with syringes, or maybe it just leaks out of your body through your liposuction holes. I don't know, but I'm really glad that I had drains, 2 drains actually, and I'm really glad that I could discreetly hide them and drain them every day, sometimes a few times a day, and that extra fluid is coming out of my body. And I mean, I can't speak from personal experience, but I want to say that I wouldn't personally be a fan of a drainless tummy tuck. I hear it involves a lot more sutures, and the people I know that have had the drainless one, they have had to go in to have the liquid manually removed, which is by a syringe from their body. And I would say that the risk of having a seroma, I believe it is, which is like a water pocket in your stomach, is greatly increased. So if you are researching plastic surgeons, definitely do your research, find out what method they're going to use. And if they are a traditional old school plastic surgeon like Dr. Kara, who has 35 years of plastic surgery experience and they still use drains, and even some of those top LA, you know, I've been watching like Dr. 90210 and those other shows on TV, and those are like top, like Beverly Hills plastic surgeons. They all use drains. So you know what? Something old might not necessarily be a bad thing, and I am pro drains. So if you've been following my journey, you know that I have had an emotional roller coaster with my mommy makeover, and part of that was just getting the support of some of my family and friends and people just sort of understanding why you're choosing to do a mommy makeover. I had a lot of people say to me, oh my gosh, Connie, you're already skinny, you don't need it, you already have big boobs, and really sort of downplaying my need or their supposed thoughts on my need for a mommy makeover, or even just my thoughts and desires on how I felt about my own body and what I wanted. And what I want to say to you is it's actually really hilarious that those same people that gave me the hardest time about having a mommy makeover are legitimately the same people that are asking me more details about it, that are saying that I look great, that it's, oh my God, what a difference, including my own mother. And I come from a really traditional Italian family. My mom was mortified and cried when I told her I was having this surgery. I had to go see a therapist to figure out how I was going to tell her. We're talking like the real deal serious. And I wanted to tell you one of the positive things that came from me having this surgery, and my mom sort of even last minute offering to come help me post-op, because initially she didn't even offer to come help me post-op. I think she was so angry, and then I think eventually she thought about it and got over it, and she offered to come and help me for a couple of days, which actually was really nice. And it really turned around in the end, because she helped me for 2 days and she saw what I went through and she saw my results. And I want to end this on a positive note in saying that my mom has actually said with her own words, Connie, you look great, and I can see why you wanted to have this surgery. And she commented on my breasts and how much more improved they are and how great I'm healing. And I feel like, without her saying it, because my Italian mother will never admit it, but I do feel like she understands and accepts now why I did what I did. And so for all those people out there who have been judging you or discouraging you, F them, because they're going to be the ones who ask you for your plastic surgeon's number at the end of all this. So guys, that was my top things I wanted to tell you that I learned and that I wish I had known before surgery. I'm only 1 week post-op now, so there may be some more items that come up along my journey. So I'll follow this video up in future with some more details. But for now, these are the top things that I wanted you to know that I wish I had known or that I learned going into my mommy makeover surgery, and I hope it helps you.